Hey, this is Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and help patients make informed decisions about their oral health. Vaping and the mouth. This topic comes up a lot. Some people vape because they think it's safer than smoking. Some people vape because they're trying to quit cigarettes. Some people started because of the flavors, stress, friends, or habit. And some people have no idea that their dentist can often tell. Now, I'm not here to lecture you like a middle school principal who just found a vape in the bathroom seal tile. I'm here to explain what vaping can do to your mouth in a clear and honest way. Here's the main idea. Vaping is not just water vapor. It can expose your mouth to nicotine, heat, flavoring, chemicals, and tiny particles. Your mouth is the front door for all of that. And your teeth, gums, tongue, saliva, and tissues are the first things to meet it. So in this episode, we will talk about dry mouth, cavities, gum health, bad breath, healing after dental work, what to know, what we're still learning, and what you can do if you vape. As always, this is general education. It's not diagnosis. If you have symptoms or concerns, the best next step is to talk with your dentist or medical provider. Vaping is not just water vapor. A lot of people hear the word vapor and think, well, vapor sounds pretty harmless. Well, vapor sounds pretty harmless. It sounds like steam from a shower. It sounds like a fog machine at a school dance. But e-cigarettes do not simply make clean water vapor. They heat a liquid and make an aerosol. That aerosol can contain nicotine, flavorings, and other chemicals. It can also carry tiny particles into your mouth and body. That matters a lot because the mouth is made of living tissue. Your gums are alive, so is your tongue. Your cheeks are alive. Your saliva is doing important work all day long. When those tissues are exposed to chemicals and heat over and over, they can become irritated. Think of your mouth like a small garden. Saliva is a sprinkler system. Brushing and flossing are the weeding. Healthy gums are the soil. Vaping is like spraying a mystery moist over the garden and saying, I'm sure this is fine. Maybe the plants look okay for a while. That does not mean nothing is happening. Dry mouth is a big deal. One of the biggest mouth problems we worry about with vaping is dry mouth. Dry mouth may not sound serious. It sounds like a small thing, but saliva is one of the most underrated players in the oral health. Saliva washes away food. It helps neutralize acid. It helps protect your teeth. It helps your mouth feel comfortable. It helps your taste and swallow. Basically, saliva is the unsung hero of your mouth. It does not wear a cape, but maybe it should. When your mouth gets dry, bacteria have an easier time sticking around. Acid can sit on the teeth for longer. Food particles do not wash away as well. That can raise the risk of cavities, bad breath, sore spots, and gum irritation. Some vape ingredients and habits may make the mouth feel dry. Also, nicotine can affect blood flow and the way tissues respond. Even if a person drinks water, the mouth may still feel sticky or dry. A dry mouth can lead to a cycle. The mouth feels dry, the breath gets worse, the person reaches for minty or sweet products. Some of these products may have sugar or acid. The teeth take another hit. It is like trying to clean your car by throwing glitter on it. It may smell better for a minute. There's still a problem there. Vaping may increase cavity risk. Cavities happen when bacteria in the mouth makes acid. That acid weakens the tooth over time. Vaping may raise cavity risk in a few ways. First, dry mouth means less natural protection. Saliva helps fight acid. Without enough saliva, the teeth have a harder time. Second, flavored vape aerosols can be sticky. Some research suggests Certain vaping aerosols may help bacteria stick to the teeth. Sticky bacteria are not the friends you want hanging around. They're like guests who show up for dinner and then move to your basement. Third, many vaping flavors are sweet or acidic. Even when they do not contain sugar like candy does, flavoring chemicals and acids can still affect the mouth environment. The mouth may become more friendly to the bacteria that can cause decay. Fourth, vaping often happens many times throughout the day. That means the mouth gets repeated exposures. With teeth, frequency matters. A little exposure again and again is a lot worse than people think. So when patients ask, can vaping cause cavities? The honest answer is vaping can create conditions that may raise cavity risk. It's not always the only reason, but it can be part of the problem. Gums need blood flow. Your gums need blood flow to stay healthy. Blood brings oxygen and immune cells. It helps your body fight infection. It helps tissues heal. Nicotine can narrow blood vessels. Nicotine can narrow blood vessels. When blood vessel flow is reduced, the gums may not respond in a normal way. This is important because bleeding gums can be an early warning sign of gum disease. Here is where things get tricky. If nicotine reduces bleeding, gums may look less angry than they really are. A person may think, my gums do not bleed, so they must be fine. But the problem may still be there under the surface. That is like the batteries out of a smoke alarm saying, great news, no fire. The alarm is quiet. But that does not mean the house is safe. Gum disease starts when plaque bacteria irritate the gums. Early gum disease is called gingivitis. The gums may look red, swollen, or bleed. If it gets worse, it can turn into periodontal disease. That is where the bone and tissue that hold the teeth can break down. Vaping is still being studied, but dental groups are concerned about the links between nicotine products, tooth decay, gum disease, bone damage, and tooth loss. Simple message is, gums do not love nicotine. Bad breath and vaping. Bad breath can come from many things. Tongue bacteria, dry mouth, gum disease, food, tobacco, sinus issues, and certain medical problems can all play a role. Vaping can add to bad breath in a few ways. Dry mouth is one. When saliva is low, odor-causing bacteria can build up. A flavored vape may smell like a mango or a mint for a few minutes, but that does not mean the mouth is clean. Mango fog is not a substitute for brushing, flossing, or tongue cleaning. Gum irritation is another. If the gums are inflamed, bacteria can collect along the gum line. This can lead to odor. The tongue is also a big player. Bacteria can sit on the back of the tongue and release sulfur compounds. That is a fancy way of saying your tongue can make smells that are not great for date night. So, if someone vapes and has bad breath, the answer is not just gum or more mouthwash. The answer is to look at dry mouth, plaque, gum health, tongue coating, and vaping habits. Mouth sores and irritation. Some people who vape notice mouth sores, a burning feeling, irritated cheeks, or a sore throat. There can be many reasons for sores in the mouth. Trauma, stress, viruses, sharp teeth, dental appliances, medications, and health problems can all cause sores. But heat and chemicals from vaping may irritate oral tissues too. If you have a sore in the mouth that does not heal in about 2 weeks, get it checked. That does not mean it is something scary. Most sores are not cancer, but a sore that does not heal deserves attention. Dentists look at the lips, cheeks, tongue, floor of the mouth, roof of the mouth, throat area, and gums during exams. We are not just counting the teeth like we're counting fence posts. We are looking for tissues too. Vaping and healing after dental work. Healing matters after dental work. That includes extractions, implants, gum treatment, deep cleanings, oral surgery, and even larger fillings or crowns. Your body needs good blood flow and healthy immune response to heal well. Nicotine can make that harder. Dry mouth and irritation can also make the mouth less comfortable. After an extraction, for example, we want a healthy blood clot to form. That clot protects the bone and helps healing. Any habit that creates suction, heat, irritation, or reduced blood flow can be a problem. This is why dentists often give strict instructions after extractions or implants. I know the post-op instructions can sound boring. Don't smoke, don't vape, don't use a straw, don't spit hard. It can sound like we're trying to remove all the joy from the universe for 72 hours. But we are trying to help you avoid a dry socket, pain, delayed healing, and infection. If you vape and you're having dental surgery, tell your dentist. We are not there to judge. We need to know so we can help you heal properly. Teens, nicotine, and the mouth. Vaping is more common among teens and young adults, and this worries dentists and doctors. Nicotine is addictive. That means the brain can start to want it again and again. Young brains are still developing, so nicotine use during the teen years is especially concerning. From a dentist point of view, young people may think, my teeth are fine, I don't have any problems. But dental problems often build slowly. Cavities, gum inflammation, dry mouth, and plaque changes can creep up over time. It is like ignoring the check engine light because the car still moves. Sure, it moves today, but the light is not there for decoration. For parents, the goal is not to shame kids. Shame usually shuts down the conversation. A better goal is to ask questions, give facts, and make it safe for them to be honest. Is vaping safer than smoking? This question comes up all the time. For adults who smoke cigarettes, completely switching away from regular cigarettes may reduce exposure to some harmful chemicals from the smoke. But that does not make vaping safe. The difference matters. Less harmful than smoking is not the same as healthy. A seatbelt makes a crash safer, but I still do not recommend crashing your car for fun. For people who do not already use nicotine, starting vaping is not a good idea. For teens, it is especially risky because nicotine is addictive and can affect the developing brain. For the mouth, we still have a lot to learn about the long-term effects. Vaping has not been around as long as smoking, so we do not have decades and decades of data yet. But we already know enough to be concerned. What if you vape now? If you vape, I want you to hear this clearly. Your dentist is not here to shame you. The best thing you can do is to be honest. Tell your dental team what you use, how often, and whether it has nicotine. That helps us look for dry mouth, gum changes, cavities, tissue irritation, and healing risk. Here are some practical steps. First, drink water often. Water does not erase vaping risk, but it can help with dryness. Second, brush twice a day with a fluoride toothpaste. Use a soft toothbrush. Do not scrub like you're sanding a deck. Third, clean between the teeth daily. Floss picks or interdental brushes can all help. The best tool is the one you'll actually use. Fourth, clean the tongue. A tongue scraper or gentle brushing can help with bad breath. Fifth, avoid using vaping to replace brushing or gum care. Mint flavor does not equal clean. If mint flavor cleaned teeth, dentists would be out of business and toothpaste commercials would be action movies. Sixth, keep your regular dental visits. If you vape, those visits matter. We can check your gums, measure your pocket depths, screen tissues, look for decay, and talk about quitting resources. Seventh, consider quitting. Your dentist or physician can help point you toward evidence-based options. You do not have to figure it out alone. Signs you should get checked. Call your dentist if you notice bleeding gums, swollen gums, bad breath that will not go away, dry mouth, new cavities, tooth sensitivity, mouth sores that will not heal, white patches or red patches, loose teeth, or pain when chewing. Also, Call before dental surgery if you vape. We need to get a plan for healing and talk through instructions. And if you're trying to quit, we will cheer for you. We may not bring a marching band into the operatory because that would be loud and probably violate safety rules. But we'll absolutely be there by your side. Simple takeaway. Here's the simple version. Vaping can affect the mouth by causing or adding dry mouth, bad breath, gum irritation, cavity risk, mouth sores, and slower healing after dental work. Nicotine can affect blood flow. Flavors and aerosols can irritate the tissues. Dryness makes it easier for bacteria and acid to cause problems. Vaping may be different from smoking, but different does not mean harmless. Your mouth is the first place vape aerosol goes. So if you vape, your teeth and your gums are part of the story. At Wahpeton Family Dentistry, our goal is to take the fear out of dentistry. That includes honest conversations about habits like vaping. We're not here to embarrass you. We're here to help you understand your health and make good choices. If you vape and have dry mouth, bad breath, bleeding gums, tooth sensitivity, sores, or questions, schedule a visit. We can take a look, talk through your risks, and help you make a plan. This is Mason Haley from Wahpeton Family Dentistry. Thanks for listening, and remember, your mouth is not a fog machine. It's a living, working part of your body, so treat it kindly.